that's my motivation. You know, these people who are dying don't need to be dying. This is exactly how it would be set up when people came in Glasgow to actually inject within the facility. So a stainless steel tray here, and then hand sanitizers, and then we would also have your disposable sharp bins on here as well, so after somebody's injected they can dispose of their needle safely.
We're here today to raise awareness around the idea specifically of supervised drug consumption facilities, or also known as overdose prevention centres. So we've brought the overdose prevention centre that ran informally in Glasgow for about a year. We brought it down to Bristol to show people, and also we planted 4,000 flowers to commemorate the 4,000 drug-related deaths that have happened in the last year. This is a policy intervention that we know works. We know it can save lives. There's evidence from all around the world over the last few decades that you can avoid overdose deaths if people don't use alone, and if there is supervision and medical interventions available.
What we would do is we'd ask people, and then we would supply the equipment. So within that we would have spoon, filters, sterile water, a needle, and the swab, and also the vitamin C or citric acid. Bristol and most places in the United Kingdom are actually ahead of us in terms of the injecting equipment that's supplied, but nobody's ahead of anybody when it comes to overdose prevention facilities like this, because we just don't have them.
So it's something that we are trying to promote and we think needs to be rolled out in the UK. And the main obstacle at the moment is actually a political one. It's not really a legal issue or an evidential issue. It's a political one. The government, for whatever reason, doesn't feel comfortable with the idea, even though the UK has spiralling levels of drug deaths.
Although many other countries have been running overdose prevention facilities for years, the first one in Bern in '85, our government just says no. And meanwhile, people who are, have nowhere of their own to use drugs, particularly to inject safely, will be doing it, in our city now, behind disused buildings, on muddy ground, in edges of our parks, and we must have a more humane response than that.
If you've got less discarded equipment, that's less councils having to go out and pick that equipment up. If you've got less infections and injecting related infected wounds, you've got less people getting admitted to hospital, which reduces the impact on the NHS, especially in a time when the NHS are already overstretched and under-resourced. And also, crucially, these support people into treatment services. We've said these phrases that we've said for years now about people being hard to reach. People are not hard to reach. We've just not got the services that are designed to reach people as of yet. Hopefully very soon the UK government will make the moves to change, because they've got blood on their hands, the UK government, by not allowing these facilities to operate, because so many people could be alive now.
For this sort of facility, it's operating in something of a kind of decriminalised legal grey area, but certainly it could happen if there was the local political will, even in the absence of kind of the political will from Westminster. Avon and Somerset Police have been quite forward-looking on drugs. There's the drug diversion programme that already operates in Bristol, where people who are caught in possession of drugs, small amounts of drugs for personal use, aren't arrested and prosecuted, but they're diverted into a health intervention. We've seen the pilot of the drug testing scheme set up by the Loop, which operated for several days in Bristol. And there's clearly an appetite for a more health and harm reduction oriented approach. And often, in fact, it's led by the police, because the police see as much as anybody that the war on drugs and the kind of enforcement-led punitive approach doesn't work. It's been tried for decades, generations now, and clearly the problems are all getting worse.
You know, we've had a UK government now for a generation saying that, you know, we need to get people off drugs, that we need to get people into residential rehabilitation. That's just a fallacy. I have my own personal experience of homelessness and public injecting drug use, and my own experience of losing family members to preventable drug-related deaths, and so many friends over the years as well that I've lost.